Thank you, Matt. Good afternoon, almost, everyone, and welcome to the techUK Building the Smarter State event. We're delighted as Cognizant to be sponsors of this event, and I think we've had a great first kind of half just before the break. Now, for the Cognizant panel, we're going to shift things up a bit. So we've got a focus on 3 critical areas that we're delivering in government. And the idea is, how are we building the smarter state now? We've got the tools, we've got the people, we've got the talent, so how can we put the foundations now for us to build on and have a very different conversation 10 years on, okay? With that, and without much further ado, let me just talk to you very quickly about who we are as Cognizant. For those of you who might not know us in the room, we're a $19 billion company listed in the NASDAQ in the US, but in the UK, we're 9,000 people strong. And in government, I'm very proud to say that because we started relatively recently, about 8 years ago, and we're about 1,400 people strong, delivering some passionate services and solutions to government. And one of them that we're focused now at the moment in this session is the Child Benefit Program. For those of you who have passed through our booth, you may have seen a video, but now my colleagues, Ayan and Amit, who I'd like to call on stage, will put the spotlight on this program. Over to you, gents.
Good afternoon, everyone. My name is Ayan Sengupta. I lead Cognizant's Process Transformation and System Integration Group. And
hi, I'm Amit Kumar. I'm the lead architect at the HMRC's Child Benefit Program. Thank you.
So in the next 10 minutes, we are going to go through some salient features of how we helped Cognizant to deliver to HMRC the child care benefit claim services. And this is something that we have started the journey in 2022 end. This is a part of a larger strategic initiatives of HMRC, which call it Single Customer Account. Single Customer Account started by HMRC with a strategic vision that we would try to achieve a single interaction point with the citizens, and that is to facilitate the digital first approach with the most personalization in nature in this case itself. Now, why we selected child care benefit claim as the first service to pilot in there? It sits very nicely in the intersection point of 3 strategic priorities that HMRC has. Number 1 is that we wanted to select a public-facing service, which is used by the citizens as best as we can. And at the same time, it was mainly putting the citizens in control for that. So they can leverage the service when they want, how they want. And at the same time, from their behavior, possibly HMRC and government will be able to learn something about them so that we can segment, we can use the data in the right way. Secondly, it has to have some good financial implications on that. So it was easy because much more reduction of the call volume in the contact center, as well as you look into that how we can reduce the paper claim submission process that can take away that cost perspective very well. But third, the wider impact is very key. We wanted to make sure that this is a smart process with a digital service adequate score, so that what we wanted to do is that HMRC, in a more positive way, can nudge and prompt the citizens to say that they can do the jobs at the right time and at the right place itself in there. So when we started the process in 2022 December, it was a simple paper-based form. It was a reactive customer-led approach itself in there, and the contact center call volumes were very high. And when we start, somebody send out the form, getting the first claim, it is almost like 4 to 6 weeks of an average time itself in there that was coming. And as a result also, it makes it very, very challenging that when the process change or policy change comes into in play, how quickly we can implement those changes and that can be put forward into the system itself in there. So another part comes into that because of the lag time between the change implementation and when the policy implementation has happened, there is always inconsistent behavior across the different channels. What is available into the website, not available into the contact center, or maybe not available into the mobile channel. So we wanted to try to take it out itself as much as possible. And we went to the solution tenets with 5 key principles. Number 1, it will be digital first, paperless process itself. Number 2 and 3, it's an omni-channel process, and I will come to that a little bit later, where we can enable the channel switch without any loss of data, without somebody has to look into this in a way that I have to input the data multiple times to take forward in there. We also wanted to make sure it's a faster delivery cycle. In a sprint-based, we should not take months, but possibly days and weeks to implement the changes when some policy changes happens. And finally, it has to adhere with the GDS standards and accessibility standards. That is one of the key criteria that we wanted to set forth for. So I will talk a little bit about what we meant by the omni-channel part itself in there. At the beginning of this process, we worked with the business team in HMRC to first reimagine the process with a point of view that it has to be smart, digital first, and it has to be with the journeys that covers all the different stakeholders in the play. So somebody who can call up the HMRC and maybe start the process in a mobile, but after some step they get stuck in there. They can move seamlessly to the web services. They possibly get stuck with 1 or 2 questions in there. And at that time, they can go up to the chatbot process, or they can call up the contact center, and they will be able to pick up that process from the exact same step with all the data that has been put forward in there. And as a result, you are not losing the time, you are gaining efficiencies. We are trying to take this forward in a much more smarter way. So I will take the time now and give it to my colleague Amit to take it forward to the how we have done it in there.
Thank you. Thanks, Ayan. Right, so talking about the fundamental building blocks and the technologies that we use to create this solution. First being, when we started, we reimagined the journeys from a user perspective with a user-centric design. We put the customer experience at the heart of the solution. It's an API-based microservice design where we make a lot of usable services that can be made readily available to be used by different journeys as and when they need it. It's a scalable and future-centric design which has intelligence and AI built into it. We use something called a center-out architecture. We are using Pega as the core technology here. What it means that the core logic can be defined in that central layer, and that logic is then exposed via digital experience APIs or the DX APIs to different channels, which means that the experience that you get as a user across all the channels is same as is controlled by that central logic, and hence the seamless experience across all the channels, which I talked about in the last slide. As an example, I would say, let's say if in a process or a journey you want to reorder the screen flow, you just do that once at the central logic in your process layer, and that is automatically then reflected on the front end across all the channels, and you don't have to do nothing about it. And hence, that gives us this much needed agility and speed to do the changes. Also, the front-end user experience layer is loosely coupled with the core layer via the DX APIs that Pega has, and it is available on the gov.uk platform, which is, of course, also GDS and accessibility compliant. All things come together to give us a solution that is agile, connected, and intelligent. And talking about the solution part, but then talking about the speed, our speedy delivery and the agility that we have been delivering this solution to. So as Ayan said, that we are not waiting for months and months to make changes. Every 3 weeks, we make a change into production, which means that a new service or a new feature or enhancement is there in the service every 3 weeks. So it's much like the auto updates that happens on your app on your smartphone. It's very similar to that. That's a continuous process that we keep doing on. We have done over 12 releases since we went private beta in the August of last year, which was followed by a public beta in September last year. And then by November, the 100% of the traffic was onto the new service. And since then, we have been continuously delivering values, new features, new process, new journeys continuously throughout that time and going forward. Right, so as you can see, we have been talking about the speed of our delivery and agility, and that's been the core theme of doing the things here in the Smart Estate. And this example is an excellent example to kind of give you a bit of perspective. So when we were doing the child benefit journey, in April this year, the government announced that the high-income child benefit charge, the limit was increased from 50 to 60,000, which means that a lot more people can then start opt back in they can pay that high income charge, but they were now eligible to do the service. We were given this challenge that how do we make this new service available in the self-service digital channel. We took the challenge, and that solution was delivered in just 22 days, from ideation to actually going live in a matter of 22 days. And that's talk about the agility and the speed that we are doing the work there. As I said, you don't have to wait for months and months for changes. There was a recent article in BBC regarding the same, which highlights that there has been a 16% increase in the child benefit claims since this change was made. And that is a real impact and financial benefit that are directly given to the bank accounts of the citizens. You can see a couple of screenshots from our digital self-service of the child care benefits. It's on the gov.uk platform. It's accessibility and GDS compliant. I won't take much time, but once you have time, I would invite you to please visit the Cognizant booth. There's a very crisp, sharp video of this journey you can see, and you can really appreciate how intuitive and user-friendly this is. And finally, we achieved some really fantastic outcomes on this program. The first being that if you, as a new claimant, go on the service on the gov.uk platform, you can complete the entire process in less than 10 minutes. And in fact, in some of these scenarios, for example, if you're opting back in, it takes as little as 2 minutes, which is fantastic for something on a government platform. The average time of a new claim being processed and you getting your first payment has come down from over 30 days to about 3 days on an average. And in fact, in some cases, the money is being paid into a customer account the next business day. So just imagine that you are going onto this platform, registering yourself for the child benefit on a Friday, and on a Monday morning, you got money in your bank account. I mean, you won't really see the government services doing that way, and that's the kind of impact this service would have. And of course, being the digital first, we see now a lot of claims on the online platform, which goes straight through without any manual intervention. And with the lot of assurance and the SMS going out to assure the customers and the speed that we do the payments, we have seen the number of calls that we get from the customer has really come down. And which, of course, resulted that now the customer score stands over 92%, which is fantastic for a government service.
And what's next for this, right? So it is very key to highlight that there is still some new customer journeys we are developing in the childcare benefit claim. And at the same point of time, we have taken over the work on the payee or self-assessment or IADB as different journeys which are running in parallel to follow the same template with some variations that is required for HMRC. But this is something that tells you that how we are trying to make the process smarter, more citizen-focused, more personal, and at the same time, we are able to bring the right level of benefit to the HMRC. So that is for the presentation. We are happy to take a couple of questions if you have, or we are downstairs into the Cognizant booth also. If you wanted to stop by and meet with me and Amit, we'll be happy to explain that to you. Any questions, please? No? So that's fine. We are here. So if you have any questions, you can please stop by at our booth and we'll be happy to explain. Thank you very much.
Thank you.
Thank you, Ayn and Amit. I'll now like to bring on stage the Pauls, and they'll be talking about the API platform that's been delivered to NHS England. So over to you, Paul and Paul.
Thank you. Right, thank you. Yep, the Pauls. You have to be Paul to work on this program.
Yep.
So Paul Martin, I run health and social care for Cognizant.
And Paul Murray, I'm a UK regional leader for Apigee within Google Cloud.
So you heard on the previous presentation that whole child benefit scheme was based on APIs. What we're talking about here is the API economy that we're building within the NHS. We're all used to, today, open banking APIs. You can now log on to your banking app, and you can pull accounts from other banks that you might have onto one app. That's all using the open APIs within the banking. So what we're looking for here is a one-stop shop for APIs within the healthcare sector as well. So what we've been doing with Google and with the NHS is putting in an API platform and looking at the services the first services that we can bring in. And so we start off with an exemplar service, something called the patient demographic service. Everyone needs to look up a patient. It's a very standard process within the NHS, within looking up. And we've taken that, we've migrated that over, and then we're looking at the next high-value APIs out there and creating that single API economy within the NHS, which we're going to talk about why that's beneficial a little bit later. So we've been doing this and taking them and bringing them together as an MVP and then releasing them as they come on the developer hub. The whole important thing is to do the hard work so that the consumers of the APIs really can utilize the services fast and easy within the NHS. But Paul, over to you. You tell me what the API economy has been doing kind of globally.
Yeah, so this is very much just a statistic that we're finding within Google, looking at our platform over the last few years, of just seeing the growth of that. Now, the growth isn't just more people using a single service, it's more and more services coming online, more and more products being delivered, whether it's in the banking, retail, healthcare, public sector, we're looking at that. And then we're talking about and analysing the impact of that, speaking to organisations saying, you've put in this program, what's it been able to give you? You know, in the past, we may have just hosted APIs, but now we're saying, no, we need to manage them to understand who's using them, what are they doing, why are they doing it, and what efficiencies they're seeing. So that's a continual message of us are seeing, you know, this surge in adoption. It's a long way from being saturated as more people say, I have disparate data pieces that I need to bring in and I need to connect and make available to either the public or business to business.
Right. And then you wanted to talk about
yeah,
a little bit around
and then
AI now.
yeah, and Gen AI comes along, and everybody says the world is going to change, and lots of it the world is going to change. But what we're seeing with that right now is more and more organisations produce Gen AI capabilities and products to allow them to offer better services and more intelligent services. That will all be API driven. You know, our Gen AI leads in Europe have many charts, and one of the interesting charts is you can't do AI without APIs. How are you going to get them out there? And then once this Gen AI product that you've built is wonderful, how will I secure it? How will I measure it? How will I potentially monetize it? Or what will monetization look like? All of these things need to be there. And especially, how will I monitor it? Who's using it to do what? Some of the Gen AI pieces of work that we're seeing are fantastic, but they're very resource heavy. How do I make sure that we control that so that I understand what my deployments are working for and what they're doing? So this curve is going to continue to go more exponential over the next years or two as we continue to work on Gen AI being supported through API platforms.
So this really is all around focusing for the citizen. The NHS and a lot of organizations, we've heard it, have created services that are very focused on an individual area, such as screenings. We do know if you're parents or anyone within screenings, you might get multiple screening letters. Those are all different services at times developed. As we develop an API economy for the citizen, we're able to actually join up those services more and more. So one of the main directions within the NHS is to have more of a citizen-facing service rather than individual services. One of the biggest API usages was during the COVID time with the NHS app you heard before. And the citizens, the patients, are a huge usage of these open APIs. It allows you to bring a service, as you heard earlier, to bear quite quickly as you have those core API services available. And then you have the producers, the people within the third parties, the back ends, that are developing those APIs for usage within the healthcare workers or the patients. And so part of this is also to have a developer hub. And this is where really innovation can come in. We all heard about SMEs trying to break into government, break into different departments. The ecosystem within the NHS, and I've worked in healthcare for over 30 years, is very difficult sometimes to get in from an integration standpoint. If we are publishing the APIs and have a developer hub in a secure way with proper onboarding, which we'll be talking about, we're really focused on the consumer here and how the consumer is going to be able to benefit from those innovations as they progress. But it's not all a panacea. We did a roundtable with digital health. And one of the things that we got feedback from the roundtable is don't try to replace integration that already works today. Look at where the industry is going. So make sure where you're doing this, you're not just replacing for replacing sake, but as you develop new services and standard services out there. But there's a huge view that as we move, we're talking about the smarter state in 10 years, that APIs are going to be the way that all the integration works within the NHS. But part of that is bringing the vendors along as well. And it's part of the techUK group. We're working with techUK around how to make sure the vendors know about the APIs, and the vendors then are being certified, frankly, or participating in it, that the existing vendors that feel like they have a stranglehold on some of the sites. So where do you see APIs going, within the benefits area after, we see some benefits?
Yeah, so what keeps Google motivated on what we need to think about as we're building API platforms and building more of them is, these pillars hit on a few things. That first one I'll take, not every API is visible or managed. And we work with organizations that say, you've got stuff on a platform, and that's great, but you've also got stuff on a bit of kit under a desk that somebody built that's now being used, and we don't know what they are. We worked with a large bank many years ago, and they said, one of the first things we said was, we're going to build a location service. Where am I and where's the nearest ATM? Person that built it then found out he was the 28th person to build that because there were versions of it everywhere. So managing and understanding your API ecosystem is hugely important, and that's something that we're trying to look at. The next biggest thing that we've got there is every API is a new attack vector. What we're doing is looking at what did we build internally to Google to protect some of our APIs. I'm sure many of you used some APIs of Google today. Maybe it was Google Search, Google Maps. How do we get here? Where do we go from? We want to make sure that we understand the API when it's out there, is it secure by design, by default? But then also, how is it being used? Is it being used by responsible users of it, or are we starting to see evidence of that API as an attack vector? You've opened the door to your organization. Is it secure? Do you know who's queuing up to get in? Can you take action when suddenly it doesn't look right? Another retailer that we worked with said, I get an awful lot of traffic from a foreign state. I doubt they're doing home delivery to that foreign state. They're doing something, and we'd like to be able to track that and say, this just looks wrong. And that's technology that we've built to protect our APIs. Google is a huge organization that's under attack daily. Some of the largest denial of service attacks have hit us. We've taken that tech that we've built, putting it into our platform so that you can have it too. They're absolutely some of the key things. And then we just get down into making sure, is it critical? If there's a problem with an API, you need to know that. Having it running on that bit of box, is somebody looking at it? Or is it in an area that we can say we're seeing degradation on response times, we're seeing or increase in faults or error codes? All of that is hugely important. And then we get into now, it's not just REST, it's not GRCP, it's GraphQL, there's still SOAP, there's lots of legacy that we need to say, I'm going to build an API that has to have a simple face outwards, but behind the scenes we'll take that complexity, we'll hide it, we'll mask it, and we'll provision it with you. That's where the development dollars are spent on the Google API platform that we have today.
And lastly, just to wrap up, we have been running a research study in partnership with UK Authority. We just published it. You can take a picture of the QR code here or come down to our booth. We've got the QR code down there as well. We looked at we did surveys, we did roundtables, we did virtual webcast panels as well with government officials. So we've now published Unlocking the Values for API Public Good that I please you might want to take a look at. Thank you.
Any questions before we move on to the next speaker? We're going to keep it really quick. I know we're standing in between lunch and the next session. So if there aren't any speakers, let me introduce you to David Fern. He's a global head of generative AI at Cognizant. And without stealing much of his thunder, he's going to talk about what we've done with the application of generative AI. So over to you, David.
Thank you very much. Standing between you and lunch, so I'll be as brief as possible. I always get these graveyard shifts. This sucks. But hopefully what I'm talking about is interesting enough that you don't mind being a little bit later to our salads and various things downstairs. So I'm David Fern, the Global Head of Generative AI here at Cognizant. Really interesting role, obviously, as you can imagine. Everything is kind of generative AI today. Perceiving to be generative AI. But what I want to talk about is actually something that we did, something that we've deployed, something that we're taking through the regulatory approaches to actually get it certified in the medical space using generative AI. So we didn't do this in the UK. We did this in the UK for a few reasons, but we did this in the UAE. So we worked with the UAE government, and essentially they came to us and said, how can we build the next generation of that amazing thing that you have in the UK called 111? They love 111 over in the UAE. And actually they have a real problem with primary healthcare. It's incredibly inconsistent. It's either amazing or pretty terrible. And there's quite a lot of inequality in how you get treated in the primary healthcare system at scale in the UAE. So they came to us and said, how can we don't want to stand up a call center because that's going backwards to come forwards. We want to start at the edge of what's possible today. And what we'd like to do is we'd like to leverage this new cool technology called generative AI, and we'd like to use it to essentially create some sort of virtual primary care solution. So we basically came up with what we call the virtual clinician. The virtual clinician is a piece of technology that essentially leverages generative AI, but it leverages it in a very, very special way. It leverages it to essentially have a conversation. It leverages it to be able to really dig in and understand and help the patient articulate very, very specific details about what's wrong with them. What we then do is once we've had that conversation, and we generally ask between about 12 to 15 questions. We actually designed this with around about 50 clinicians over in the Department of Health in Abu Dhabi specifically. We ask questions that are straight down the line, one leads into another, leads into another. We're able to ask counterfactual questions, all entirely autonomously. We're able to ensure that each next question that we ask aligns to a human's thought process about what the next question should be. And we're able to essentially get to a point where we can really help a user to articulate what's wrong with them and how they feel in an incredibly high fidelity way. But once we've had that conversation, the next most important thing is how do we then actually apply that to some triaging process to essentially imitate or kind of provide that 111 outcome, the next best action. Go here, go there, or you're fine. So what we then do is we take that conversation, that intention that we've captured about the user, we then go and garnish it with some grounded knowledge, some medical knowledge that we've got from medical information around the world. And then essentially we go and pass that off. We go and pass that off to 29 different AIs. Each AI represents an individual medical specialism. Why do we do that? Well, what we found was to minimize bias, to minimize cognitive overload, to minimize hallucinations. We basically have every single, and also to give the best possible outcome to the user, we essentially pass that conversation that we've just had off to all these different AIs. And each AI represents an individual medical specialism. We then use a consensus mechanism to essentially come back to another AI that says, over these 29 AIs, I can see that 1, 2, 6, and 7, so internal medicine, neurology, and gastroenterology, has said that it's this problem. This is the diagnosis. And essentially our consensus mechanism there says, yes, I agree. And we do a validation and evaluation, and then we're able to actually pass that on and decide what the next best action is. But what that strategy gives us is a huge amount of transparency about how our system has gone from the conversation with the user to the outcome for the patient. It gives us the ability to prove transparently and immutably what has gone on and the decision thought process that the system has taken to go from A to B. The reason I bring this up, and by the way, the outcome of the whole system is essentially to get the user to the next best action. That next best action could be the pharmacist, if you've got a skin condition. That next best action could be you need to go and see a specialist consultant. And we can very easily take you to exactly the right secondary healthcare solution. It might be that you still need to go and see your GP. And actually, that's our fail-safe. That's how we get to such a high level of accuracy in the system. Or lastly, it might say you need to go to hospital. I have a personal story that kind of supports the development of this, where I phoned 111 and told them how I felt. And they said, you've just got indigestion, don't worry about it. And then about 3 hours later, I was being blue lit into hospital with an appendicitis, rupturing appendicitis. I put those same conditions into generative AI, into this system that's now highly tuned and capable, and it doesn't just ask me the questions that are kind of like next on the if, this, then that. it essentially can really dig in and help me to expand on the questions that it thinks are most appropriate to ask next. So the reason why I bring up all these different parts of it was one of the big challenges we found when building this was technologically it was very easy. With all due respect, it was not a challenging thing to build once you understood a lot of these kind of technical parts. But what was challenging was actually building, in parallel to the technology, an approach to regulate this solution, an approach to actually give the UAE a framework within which they could benchmark the solution and benchmark it against what they, or the way that they liked to essentially regulate medical devices. And that was where we started to actually work very, very deeply with the government of the UAE and help them to essentially pathfind a lot of new regulation to essentially develop or create a regulatory framework in which the doctor could exist and actually pass their initial clinical trials is now an equitable front end to primary healthcare for over 4,000 citizens of the UAE. We actually have a live demonstration of this, and apologies for my voice, I just realized how awful it is. We have a live demonstration of this on our booth if you want to come and see, play, put your own kind of problems in. It's often not a very easy sell to get people to use this demo because sadly, most of the time, most conditions come down to poo, wee, or puke, which isn't something that many people want to kind of talk publicly about. But we would highly advise you to come down and see us. We've had this independently verified at around about 98% accuracy. We can triage with that 98% accuracy 918 different conditions. And this time last year, November last year, we were actually at an APPG in Parliament just across the road, actually presenting this to a group of ministers and lords about kind of the process that we took to develop regulation that could support the innovation of these kinds of services and actually bring this to reality for the UK as well as the UAE. So I'll hold it there because I appreciate I am between you and lunch. If you'd like to come and see this and test it and actually have a go yourselves, please come see us on our booth. And if not, I really hope that's open up your mind about what's possible today. Thank you very much.
Thanks, David. Any final questions before we conclude the session? Any questions from the audience? No, brilliant. I think everyone's rushing for lunch. Sorry, did I miss one?
Yes. So I think you missed the punchline on describing your personal circumstances there, where you had your ruptured appendix or whatever. When you put your symptoms into this model, what did it tell you?
Sorry, it did literally say, next best action, go to the hospital, and you've got a possible appendix rupturing. So it's absolutely accurate.
Thanks.
Thank you, yeah, sorry. It did work, it does work, I promise you. Yeah, please do. Oh, 1 second, I think there's a microphone whizzing its way to you right now.
I'm so delighted to see this. It goes back to my previous question/statement about joining up and collaboration and actually people who have health conditions that aren't obvious specialism related, where you've got a collection of odd syndromes. You just fall through the gaps in our health service at the moment. I've got a disabled daughter who is absolutely incapacitated by a set of weird symptoms, and there just isn't a pathway for her. She's passed from pillar to post. So I'm going to be at your booth trialing your solution.
Please do.
I think it's going to be, when is it coming?
I think,
I'd love to know.
As I said, so it's really interesting you mentioned that, because actually we're also developing the same technology for a lot of different applications. Because imagine if you could talk to a medical professional who could help not give you, by the way, this solution is not meant to replace doctors, right? The solution is meant to provide the infinite empathy and continuous attention that is required for both triaging at a population scale, but also being able to do those more specialist kind of care circumstances, where actually, how often do you get to see or have some advice or be able to have a conversation where, your information can be synthesized in a way that could provide some really interesting insights to you specifically. But you're just not going to get that in a human setting because we don't have thousands of specialists. We probably don't even have hundreds of specialists. But with these kinds of solutions, but when's it coming? Well, that all comes down to the people in this room helping to kind of accelerate these, the governance, the ability for us to actually put this in place. Now, the AI Act, the UK AI Act, is all about kind of innovation-first regulation. And what we're trying to advocate for at Cognizant is innovation-first regulation in the AI space so that we can drive forward these solutions in a meaningful way, a safe, by the way, meaningful way, that can help to accelerate these solutions into the hands of our citizens and provide a better overall outcome for everybody. But thank you, that's a great point.
Amazing, thank you so much.
Thank you.
One more question over there. If we've got time, have we got time?
Yeah, we have.
Excellent.
We have one more.
Again, fantastic technology, by the way. So just curious, how much of this from your architecture are you keeping proprietary? How much are you making this open for transparency?
Great question, great question. So I'm currently studying for my PhD, and this is part of my studies. It's all about human AI optimization and acceleration. And actually, this for me is a massive opportunity for us to open source our thinking, our approach, so that we can accelerate collectively. You know, at the end of the day, at Cognizant, we don't make money by selling IP, quote unquote. We make money by helping to deliver, optimize, and embrace that technology for our clients, and you know, the government being a big one of those. So for us, open source is a critical importance. We publish a huge number of academic papers on a regular basis that kind of talk about all of our primary and kind of first principles research in this space. So it's absolutely something that we would want to kind of elaborate on and drive forward. Excellent. Right? I think that's lunchtime.
Thank you, David. I won't keep you any further. To conclude, I hope you found that interesting and useful. And I'd just like to say, and to Kathy's point and David's point as well, it does take collaboration, partnership, and integrating across departments to make this possible. So with that, thank you for all your attention, and hope you have a good event. Thank you.